Welcome to this Cosmo Education session. Today, we'll be discussing an article published in 2018 in the Journal of Personality Assessment titled Therapeutic Assessment in Personality Disorders, Toward the Restoration of Epistemic Trust, written by Kamphuis and Stephen Finn. The article introduces therapeutic assessment, a semi-structured method of collaborative psychological evaluation aimed at helping clients gain new insights and make positive changes in their lives. In this approach, both the client and the assessor work together throughout the process. It begins with formulating personalized assessment questions, which then guide the testing phase. This is followed by a joint discussion of the client's test responses and behaviors during the extended inquiry phase of standardized testing. The process continues with targeted experiential experiments during the assessment intervention session, an interactive summary and discussion, and a written synopsis of the entire process and its results, provided to the client in accessible language. The final step involves a follow-up session to reinforce the insights gained. A related method, collaborative assessment, shares many of the principles and techniques of therapeutic assessment but is applied in a less structured manner. Empirical evidence has been accumulating in support of therapeutic assessment and collaborative assessment as effective interventions in various settings. Recent summaries of the research highlight the positive outcomes associated with these methods. A meta-analysis on the use of psychological assessment as an intervention revealed effect sizes consistent with moderate improvement in both process variables, such as therapeutic alliance or client satisfaction, and treatment outcomes, such as symptom reduction. When looking specifically at treatment process variables, the improvement was even more pronounced. The article suggests that epistemic trust theory offers a compelling framework for understanding at least 5 significant findings that have emerged from research on the effectiveness of therapeutic assessment and collaborative assessment. It goes on to discuss selective empirical observations regarding the effectiveness of therapeutic assessment, highlighting how epistemic trust theory can explain these findings, which emerge from the existing research on both therapeutic and collaborative assessment. First, they raise the question of how therapeutic assessment proves to be effective across a wide range of disorders and client types without requiring substantial procedural modifications. Research combining controlled group designs and repeated measure single-subject experiments has shown that therapeutic assessment can benefit clients in diverse settings. These include residential treatment for substance abuse, counseling for college students with depression, anxiety, and interpersonal issues, couples dealing with chronic pain, boys with oppositional defiant disorder, outpatient clients with borderline personality disorder and suicidal ideation, multi-problem families with emotionally disturbed children, and clients with complex PTSD, among others. The breadth of these impacts suggests that there are overarching, meta-theoretical change processes involved. But what exactly are these processes? The second question addresses the brevity of the intervention. Most of the studies cited, including those in the meta-analysis mentioned earlier, involve fewer than 5 client sessions. Yet, the clinical impact of these brief interventions appears to be comparable to much longer therapies. This raises the question, how is such a significant effect possible in such a short period? Third, the authors explore how therapeutic assessment can be effective for clients who are typically resistant to change and generally require long-term, intensive, relationship-based treatments, particularly those with personality disorders. A randomized controlled trial involving 74 clients with complex personality disorders showed that while self-reported improvements in symptoms and demoralization did not appear immediately after the 5-session therapeutic assessment protocol, clients undergoing the assessment had higher expectations for treatment success, felt they had made more progress, and reported greater satisfaction and alliance with their clinicians compared to those in the control group. Qualitative analysis further revealed that relational aspects of the assessment, such as feeling validated and gaining new personal insights, were crucial to its impact. The fourth observation concerns therapeutic assessment's effect on clients' motivation for treatment and their subsequent alliance with treatment professionals. Studies have consistently documented the positive impact of therapeutic assessment on alliance, engagement, and treatment satisfaction. Clients who participate in collaborative therapeutic assessment are significantly more likely to follow through with recommended psychotherapy, develop stronger therapeutic alliances, and foster better relationships with staff and other residents in residential treatment settings. Lastly, the fifth key finding is related to the delayed effects of therapeutic assessment. While most psychotherapies see a decline in positive outcomes after treatment concludes, multiple studies have shown that the most significant positive effects of therapeutic assessment are often seen not immediately after the intervention, but sometime afterward. This delayed impact raises the question of what accounts for this phenomenon, especially given that most treatments tend to lose effectiveness once they end. While more empirical research is needed to fully understand the specific mechanisms of therapeutic assessment, the authors suggest that epistemic trust theory provides compelling and plausible explanation. In particular, this theory may help us understand why therapeutic assessment is so effective, especially in clients with personality disorders. The article then delves into the concept of epistemic trust and its relationship with personality disorders. Epistemic trust, as defined by Fonagy and his colleagues, refers to the trust an individual places in the authenticity and personal relevance of information that is transmitted interpersonally. When a person experiences epistemic trust within a relationship, they can absorb, accept, and learn information from the other person, gradually integrating this knowledge into their view of themselves and the world around them. This kind of trust is crucial for both individual and species survival, as it enables humans to learn and apply culturally relevant information across generations, allowing us to adapt and thrive in a constantly evolving world. However, epistemic vigilance, being cautious about the accuracy and relevance of information, is equally adaptive, as it protects individuals from accepting false or misleading information. Both epistemic trust and vigilance serve important roles, but a balance between the two is essential for healthy functioning. Fonagy and his colleagues have written extensively about a state of pervasive distrust known as epistemic hypervigilance. They believe that this hypervigilance is particularly prominent in individuals with personality disorders. In such cases, individuals struggle to flexibly navigate between epistemic trust and vigilance. As a result, their perceptions of themselves and the world become rigid and resistant to change, making it difficult for them to learn from social experiences. This cognitive inflexibility and the inability to adapt to new information are key characteristics of personality disorders, as are the severe interpersonal difficulties that often accompany them. Epistemic hypervigilance can be understood as an adaptive response to childhood maltreatment. While this heightened distrust may protect the individual from harm during early life, it often leads to communication breakdowns and social dysfunction later on. The authors also suggest that another form of maladaptive trust, epistemic hypovigilance or naive trust, is common in individuals with personality disorders. Many clients may oscillate between states of hypervigilance and hypovigilance, experiencing moments of extreme distrust followed by periods of overly naive acceptance of information. The article continues by discussing the strong connection between epistemic trust, attachment theory, and mentalization. Fonagy suggests that attachment experiences, particularly those with primary caregivers, play a critical role in shaping the development of epistemic trust. Secure attachment fosters a sense of trust in others, making it easier for individuals to accept and learn from social information. Conversely, insecure attachment may lead to epistemic hypervigilance, where individuals become distrustful and overly cautious about the information they receive from others. Mentalization, on the other hand, refers to the ability to understand both one's own and others' mental states, which is essential for the flexible use of epistemic trust. When individuals can mentalize, they can process new information, adapt their understanding, and trust the knowledge they gain from interpersonal experiences. Therapeutic assessment plays a crucial role in restoring this capacity for mentalization by providing a structured, supportive environment where clients can safely explore their thoughts, feelings, and behaviors. According to Fonagy and his colleagues, when mentalization is impaired, individuals struggle to engage in healthy epistemic trust. This creates significant barriers to learning from others or adjusting their views based on new information. Therapeutic assessment addresses this challenge by offering clients opportunities to re-engage with mentalization. Through the collaborative nature of the assessment process, clients are encouraged to process and integrate the information they receive, fostering a renewed sense of trust in the knowledge gained from their interactions with the assessor. The article also outlines several distinctive elements of therapeutic assessment that make it particularly well-suited to fostering epistemic trust in clients. First, the collaborative nature of therapeutic assessment encourages curiosity and active involvement from the client. Rather than being passive recipients of feedback, clients are treated as collaborators in the evaluation process. This sense of agency is reinforced by allowing clients to generate their assessment questions, creating a foundation of trust in the relationship between the client and the assessor. Second, the assessment process is attentive to the natural human tendency towards self-verification, where individuals are more likely to accept information that aligns with their existing self-concept. Therapeutic assessment assessors are trained to provide feedback in a way that gradually expands the client's understanding of themselves while offering emotional support to prevent overwhelming experiences that might lead to disintegration, where clients may feel as though their sense of self is destabilizing or collapsing. The third feature is the careful use of psychological assessment instruments. These tests are selected to create structured opportunities for clients to see themselves through the lens of scientifically validated tools. By confirming aspects of the client's narratives while also introducing new insights, the use of these tests promotes a sense of trust and deeper understanding. Clients can reflect on the results of these instruments, which help them integrate new information without feeling threatened. Finally, therapeutic assessment is especially attentive to the emotion of shame, which can be one of the most intolerable experiences for individuals with personality disorders. The assessment process is designed to minimize the risk of triggering shame, treating clients as competent individuals and avoiding judgment. The pacing of feedback, along with empathy and emotional support, allows clients to confront sensitive topics without overwhelming feelings of shame. This careful handling of feedback helps build and maintain epistemic trust, even when dealing with deeply personal or difficult issues. The authors conclude by highlighting the potential of therapeutic assessment, a powerful tool for restoring epistemic trust in individuals with personality disorders. Through its unique combination of collaboration, mentalization, and the careful use of feedback, therapeutic assessment helps clients gradually lower their defenses, engage with new information, and rebuild their capacity to trust and learn from others. In doing so, it provides a pathway toward healthier, more flexible relationships with themselves and others, allowing for more successful therapeutic outcomes. By moving beyond the entrenched patterns of epistemic hypervigilance, clients can begin to re-engage with life more openly and adaptively. The principles of therapeutic assessment also have significant implications for psychotherapy practice and future research. For clinicians working with individuals who have personality disorders, adopting a collaborative and curious stance, allowing clients to actively participate in shaping their treatment, can foster the development of epistemic trust. This focus can help clients shift from rigid, self-defeating ways of thinking to more adaptive patterns of relating to both themselves and others. Looking ahead, future research should aim to further investigate the specific mechanisms through which therapeutic assessment fosters epistemic trust, as well as how these processes contribute to long-term therapeutic change. Additionally, exploring the application of therapeutic assessment principles in other therapeutic contexts, such as group therapy or couples therapy, could reveal its broader potential in promoting trust and engagement across different client populations and settings. Thank you for joining us in this session of Cosmo Education, where we explore the impact and potential of therapeutic assessment in personality disorders and its role in restoring epistemic trust. Stay tuned for more discussions on cutting-edge research and practices in the fields of personality assessment and psychotherapy.